great. It's a reunion of sorts from our fellowship days. A couple of projects that we're working on in the QA committee. One is we're working on a mission statement, kind of to clarify the goals and objectives of the committee, and that will be coming to REMAC in the near future. There's a few ongoing studies that we've been working on. One is the trauma study that Dr. Schenker was heading up. Kind of what came out of that study, or I guess it's more of a survey, was really that there's a disconnect between how people notify trauma centers and what trauma centers expect in terms of notifications. There was some discussion of really either combining or what to do with the decision to transport to a trauma center based on criteria and the notification. And should they go together? Should they not go together? The decision was made to refer that to RTAC for more in-depth discussion. There are a few. We're kind of getting our feet wet in a couple of different topics. And a lot that we're interested in doing on the naloxone study, or at least some information on what's going on regionally here at this committee, so that people are aware in terms of the EMS side of this public health emergency. There's the beginnings of a fatigue study that Morty Lax is leading up, and one of the other items that's on our list that will be coming to you soon is the stroke unit oversight. We've been reviewing PCRs, and I'll report back to you at the next REMAC meeting about what we're finding. And then the last thing is really, I'd like us to consider as a region identifying key quality improvement items that we can work on, the clinical quality improvement items that we can all agree that are important for patient care. So one of the things that we've discussed, and we had a visitor at the last QA meeting, which was on February 8th, Sheree Murphy from the HA came, Mission Lifeline came, and we discussed the idea of standardizing what we all collect in terms of, in this instance, we were discussing STEMI care. And so what things should we be looking at related to STEMI care? Should we all be expected to kind of identify and collect the same data so that we can look at how we're improving over time? So this will be come to you more formally, but those are the projects that we're working on.
Great, thank you.
Can I just ask, how is your QI committee's request to the RTAC going to fund?
Dr. Schenker is going to make that request. I'm not sure how officially that will happen.
You know Dr. Simon is?
Of course.
Okay.
It'll probably go as chair of REMAC to the chair of the RTAC.
That's the idea.
Right?
Can we just tell him now?
Yes.
Yeah.
Do you
need an offline?
Send me an email.
Yeah.
Fine.
We'll connect you.
Go ahead.
So, and just to I guess add to the discussion is, I guess the idea is, so I don't know the answer. I mean, I'm relatively new to the chair position, but the idea is that we would communicate to you about kind of deciphering this issue a little bit further in terms of what do trauma centers expect from EMS in terms of
I think
notifications?
it's really closing that gap between what you're getting and what the trauma centers need.
That's not a good one.
No, please.
You know, for our notification, I represent RTAC and we've had conversations that's the information that's expected or requested from us for vital signs, PCS, and all that. So when we've sent it to RTAC, we've had discussions there before, we'll do it again, but we've had these conversations.
Right, but I think there's two issues. There's that piece, but there's the bigger piece of when is a notification required. And I think one of the issues we're seeing is that sometimes what trauma centers expect they would get a notification for, they're not getting, and it's really, so there's two pieces. There's what's in the notification and who are the right.
You know, one of the things that
I think it's even a bigger issue. Are we bringing trauma patients to trauma centers? In Brooklyn, 30% go to non-trauma
Right.
centers. That's just a fact. So that's part of the discussion that Ron has to have, I guess, with the EMS.
Go ahead.
well, no, I think that's the really bigger issue.
Right.
And
That's
I
the big
agree with
picture.
you, that patient's not, trauma patient that goes to non-trauma centers. So I think the information is, there's like 5 key elements that they're requesting, but that's the bigger issue, which that's one of the biggest issues coming out of RTAC is trauma patients go to non-trauma
Right.
centers, so that should be the focus.
Right, and what's the gap? There's a knowledge gap for providers, so I think that's part of what you're working on, right?
So I mean, there's a larger picture to it also, which is the kind of the education around it, but then the update of the trauma criteria. There's some differences between the CDC criteria and regional criteria. So that's another point. You know, we haven't yet referred it to protocol, but that's a consideration moving forward about updating the criteria.
Would that be another, hate to say it, another tag, actually, working with the residents from RTAC on this?
Well, I was going to suggest that as part of a subcommittee, well, this is QA, right, that's looking at this.
QA is looking.
So as a subcommittee of QA, maybe you can get some RTAC representation and work with you and,
Is that QA a protocol?
well, QA is looking at the issue, I think, and then it may need to go to protocol for a change in the appendix F or whatever, but, yeah.
We will jump at the opportunity, just let me know and we'll put something in, we'll connect and,
Great.
All right,
we'll.
so you'll work it out.
Great, thank you. Anything else for QA? All right, any unfinished business?
I actually have, City College of New York
Yes.
had sent in a BLS first response application. And I believe they completed it, I believe that they made an agreement with Senior Care. Is Robert Ackerman?
Yeah, he's still there.
Do you know of any transport agreement that was made with City College?
I don't know.
I'd like permission, because it's been dragging on for so long, I'd like permission to work with the executive committee, so if this application is complete, we could just approve it.
Is there any objection to that? Okay. Any other unfinished business? Dr. Marshall?
It was, talking about trauma, but about a year and a half ago, we started a small group to talk about pediatric transport in the region, based upon the recommendations of the staff that major pediatric trauma should go to a pediatric trauma center. So I think it's,
Was Dr. Cooper working on that with you, or?
yeah.
Yeah.
So, but I think maybe that group could get back together.
Yes. Do we know who was in that group still?
Yeah, I
Yeah.
have.
Yeah, so maybe we can reconvene that group and,
Yeah.
We should probably add Matt Harris to that group.
yeah, Matt Harris would be a good addition to that group. Dr. Harris.
Pediatric trauma.
It's a pediatric trauma, focusing on pediatric trauma transport. And then maybe they can report back after they've met.
Schedule meetings.
Anyone else have any unfinished business?
We also, sorry, new business, sorry.
All right, maybe Paul has new business too, is that one thing? Go ahead.
So, just a forwarded suggestion from the REMAC liaison for the Certification and Credentialing Committee, just an open plea for additional physician-directed call review lectures. Many of you in the room do or do not hold call review, and we would just like to have, there seems to be a paucity of call review in the area, and it's brought up routinely at the CNC committee to expand call review. So if you're thinking about giving a lecture, please make it call review. They get plenty of symposia, they get plenty of didactics, they need call review. And if you have any questions, just get me offline, and getting them approved for REMAC CME call review is no issue.
Doug, do you want to mention this?
Thank you.
Yeah.
So from May 4th to May 7th, the FARC will be hosting its 5th annual now Medical Special Operations Conference.
We have flyers up here.
Yeah, we're going to pass them
Yeah,
around.
there's some flyers, so feel free to take one. We're working on our CMEs, we play CME, people from all over the country who attend, and also we have a lot of people from international, from Australia, from other places, and the focus on search and rescue medicine. However, we have a few additional topics
You have a
that will
couple
be added in the
pre-conferences?
next week or two that I think a lot of people will find interest to outside of the ESAR community. So,
And there's some canine care, some pre-conferences that are interesting
yeah,
as well.
so we have pre-conference, we're running a TECC course, we're actually doing a 2-day canine course, so that's something unusual that a lot of us don't get exposed to, hazmat, and field amputation course, that we did at the Northville Bioskill facility. Dr. Lyman and several other trauma surgeons are involved, assisting us. And they generally, there's small, like, mini lectures in the mornings on both days. We go to Randall's Island Fire Academy, followed by the afternoon, some skill stations. So, and then we have a evening event at the Fire Museum Friday evening. Commissioner does a welcoming, and the bar doesn't hurt, and then as well. So, but it's really a lot of good folks, a lot of people on the federal level, military, and EMS, and fire folks from around the country. So,
Thanks.
thank you.
I have one other
Go ahead.
item. Mount Sinai had submitted an application for online medical control. It was reviewed by staff, and it was also reviewed by Dr. Kaufman, and Dr. Schenker actually did the on-site. It's which hospital is it in? What site is it at?
Transfer center.
Okay. Everything is in place, and they're ready to roll. We're just waiting for REMAC approval.
So do we need to do that now? Yeah.
We need to do that now.
So, I heard someone said,
Move to approve.
second?
Second.
We're all in favor?
Aye.
Against? Abstentions? You're abstaining? You're,
I mean, is it conflict?
I abstained as an executive committee member of the site visit, so. All right, so that's approved.
Thank you very
I
much.
like it, I like it.
Any other new business? If there's no new business, I'll entertain a motion to adjourn. Second? All in favor? Adjourn.
Thank you very